So good day ma'am, so I am Kirby Huntilla. So today I'm going to perform the self-injection of insulin. So first is we have to prepare the equipment. So we have here the equipment needed. So I have here the alcohol, the syringe, the cotton balls with alcohol and the vial and the chart of the injection site. So I have here. So first thing we're going to do is we're going to identify our patient and we're going to explain the 10 rights of medication administration, of course. And then we're going to assemble the equipment needed in performing the procedure. So place it on the table accordingly to facilitate easy access with the equipment. So to, uh, to have enough time and to facilitate easy access to the equipment that we're going to use, and then have the patient wash their hands, and then we can use other disinfectant like alcohol to wash our hands, of course at the same time, just like this. Then allow our patient to do it the same, just like for what we did. So we're going to give her an alcohol or other disinfectant, so assuming he or she already done disinfecting her hand. So after that one, have patient manipulate the syringe and that explain that what are the parts of the syringe that need to remain sterile. So ma'am, ito po yung syringe. So ito dapat yung area na huwag natin hawakan dahil para hindi makontaminate. So ito yung plunger, ito yung needle. So yung needle, bago po natin hawakan. So ganun. So assuming we already done explaining the parts of the syringe to our patient. And after that one, we're going to discuss the ordered dose of medication. So it is important to explain the ordered dose of medication for our patient that have the accurate dosage of medication that he or she needed. Then after that one, have the patient check the label of the vial. So after that one, we're going to check the label of the vial. So we're going to give it to our patient. So let him or her check it. And if the medication is insulin, have the patient inspect for the change of color and to warm the room temperature. So we're going to give it to the patient. We're going to explain it to the to our patient what are the labels, and then for the expiration date of the vial, of course, to prevent the introducing of expired insulin to our patient. So better he or she knows what are the labels, just like for example for the expiration date. So we're going to give it to our patient and explain or discuss what are the labels of the vial. So that's it. It's very important. And next we're going to demonstrate the steps necessary to develop the to draw up the medication. So we're going to demonstrate it on how to draw up the medication. So we need to perform it as a nurse first before our patient. So first thing we're going to do is we're going to wipe it with the tip of this vial with alcohol with the alcohol swab, or so do not touch the tip to do not contaminate this vial. So we're going to wipe it. After that one, we're going to discard. So next to that is we're going to pull the plunger. So we're going to open it first. Pull the plunger in a desired dose that we're going to use. So after that one, we're going to inject it to this vial. So inject it to the vial or push it back into the vial and hold the syringe together up or both upside down and get the desired dose. So just like for example we need 20 units, then we're going to pull back 20 units like what we pull the plunger earlier. So we're going to get the desired dose while our hands are, we're going to pull it by using our dominant hand. So without touching the inner plunger. So to avoid contamination, of course, we need to do it accurately to prevent contamination. So after that one, we're going to check for the presence of air inside the needle, inside the syringe. So if there are presence of air inside the syringe, we're going to draw it back and then we're going to repeat. We're going to get again the desired dose that we are needed. Then we're going to remove the syringe from the vial and then of course recap this syringe using tissue. So just like that. So we need to do it accurately to prevent any contamination with our equipment and then show the chart of injection site for the patient. And we're going to discuss the importance of systematically rotating site. So here is the sites of injection site of the if you are going to inject the insulin. So over here the outer arm for our abdomen and for the leg. So we're going to choose. So you're going to choose what? So we're going to choose the abdomen. So my patient shows us the abdomen site. So it is important to discuss the importance of systematically rotating site to prevent forming of scar tissue that the drugs cannot be absorbed by the skin of our patient. So that is very important. So next is we're going to administer the injection. So first is we're going to administer the injection. So we're going to administer it and then we're going to clean the injection site with alcohol. So I have here my alcohol soaked with my cotton ball soaked with alcohol. So we're going to clean the abdomen in a circular motion. Then we're going to do that and then we're going to get the syringe. So we're going to remove the cover or sheath of the needle. So make sure you remove it accurately to prevent needle stick. So it's very important because it's very dangerous because it's needle. And then we're going to hold the syringe as if it's like a pencil, just like this. And then we're going to brush the skin with using our thumb and the index finger or fingers. So that's it. And then after that one, we're going to insert the needle at 30 to 60 degree angle. So after that one, we're going to insert the needle while holding it holding it on the skin. So after that one, we're going to introduce or inject the drug, and then we're going to remove the needle and then place alcohol pad over injection site. So we're not allowed to massage the injection site. After that one, discard the uncapped needle to sharp container. So make sure we discard it to the sharp container for us to have the needle secure, we dispose it properly to sharp gainers to prevent needle stick. So assuming I already discard it to the proper container, and after that one, of course, make our patient comfortable again and discard the uncapped needle to sharp container, and have patient indicate the record chart for the injection that is given, and we're going to give opportunity to our patient to ask questions. So ma'am, do you have any questions or clarifications regarding the procedure? If there are none, thank you. So feel free to ask questions to me if you have any questions or clarifications, and provide guidelines to the patient with written literature and visual aids, just like for example our sites of injection sites. So I will provide guidelines to our patients. So this is your guidelines, mom, for your injection sites. So keep it with you, and then document the evaluation of learning process. So we're going to document everything done in the procedure. What we done to our patient, we're going to document it. So that's it for self injection of insulin. Thank you.